Thank you. My name is Bernard Emejiru. I obtained my first degree in medicine and surgery from the University of Nigeria and worked briefly in private and public hospitals before migrating to the United States of America in 2010. I'm currently working as an assistant director, Department of Regulatory Affairs, Kings County Hospital Center, Brooklyn, New York. Brooklyn is a community that has diverse population and faces the common problems of limited medical access, drug abuse issues, mental and physical health issues like any other community. On conducting a community health need assessment, I have been involved in the conduct of a community health need assessment that involved the Department of Health, New York City, with the 5 boroughs of New York City, where we assessed the implementation of electronic health records in selected hospitals in the 5 boroughs of New York City, which include New York City, Manhattan, Bronx, Brooklyn, Long Island, and Queens. We also assess how electronic health record system will promote medical service delivery to the indigents or citizens of the city. Another project I participated that also helped a little bit is while in Kings County Hospital, I was involved in the review of stroke patients in accordance with the American Heart Association guidelines and under established guidelines and protocols to provide stroke services to life-saving treatment for patients that have stroke, and also benefits to community members generally. On my projects in community assessment, I will be glad if I have the opportunity to work with counseling, with community counseling and mediation centers, which render services like mental health clinic and social center all around the city. It's going to give me an opportunity to interact with seniors, veterans, young and old men and women for social interaction and also to be able to know their medical needs. I also like to work with youth centers across Brooklyn or behavioral health clinic in any of the hospitals in Brooklyn. This will afford me the opportunity to assess the needs of my community members. Thank you very much.